In tonight's Health Watch, hypertension or high blood pressure can lead to devastating consequences.
But it doesn't have to. Local 5's Connie Feldman shows us what we can do ourselves to lower our blood pressure.
Left untreated, high blood pressure can lead to severe health complications, including heart disease and stroke. But health experts say something as simple as healthy lifestyle changes can save lives.
You can have things like heart failure, heart attacks, stroke, kidney failure. These are the most common complications of untreated high blood pressure.
Dr. Amit Gupta with Aurora Baycare Medical Center Family Medicine explains high blood pressure is when your heart has to work harder to push blood through arteries that are smaller than they should be for a variety of reasons. Those include smoking, lack of exercise, and excessive alcohol use. Gupta also says some people are at higher risk for developing high blood pressure.
High blood pressure can be found in any age group or any race, but patients who are African American or Hispanics are at higher risk for having high blood pressure.
Gupta says the long-term health effects of hypertension can be fatal, but they don't have to be if the condition is caught early enough.
Anybody after the age of 40 should be screened annually, irrespective of their race.
Health experts, like Aurora Baycare registered dietitian Carrie Tyker, says diet and exercise play a big role, and so does something many are dealing with right now: stress.
Yoga is an excellent way to reduce stress.
Tyker says incorporating more exercise into your lifestyle doesn't have to be a chore. Pick something you love and mix it up a bit.
Even a fun activity like dancing is a good way to relieve that stress. The best thing you can do is include a variety of different exercises.
Tyker recommends the DASH diet, which stands for Dietary Approach to Stop Hypertension. It includes more fruits, vegetables, and whole grains with less red meat and fewer sweets.
Controlling that intake of salt is really a big notable one that we think of when it comes to high blood pressure.
Gupta says one of the best things people can do to monitor their blood pressure is to keep up with preventative visits, even scheduling a virtual visit. He says with all the added safety precautions in place right now at Aurora Baycare, patients can feel very safe going in to get the care that they need.
We have staggered appointments so people are not crowded at one time. And lastly and importantly, everybody who comes in physically in the location gets screened.
While lifestyle changes may be simple, that doesn't necessarily make them easy. It takes willingness and commitment to adopting a healthier way of living. And that's why Aurora Baycare is here to help. To learn more, you can call Aurora Baycare or email HealthWatch at aurorabaycare.com. And that's your Health Watch. I'm Connie Feldman, Local 5 News.